Hello, this is Dr. Stephen Evans. I'm the editor-in-chief and publisher here at Outclick Magazine. Today we're excited to talk to people and members of the Beachcomber Family Center for Addiction and Recovery. At a challenging time for today, things are changing. People are battling with many different addictions, and this is a wonderful resource for people to reach out to. We want to welcome today Michael, Genna, and Eric. Hello, how are you all doing today?
Great, thank you.
Good, thank you.
Thank you, and welcome. You all are great clients in the magazine and providing a wonderful resource to our community. Michael, we want to start with you. If you want to tell us, you are a therapist there at the Beachcomber. You do many services, and you also work with the LGBT program. If you want to tell us about what you do, the services you provide, and about the LGBT program.
Thank you, Stephen. Yes, I've been with the Beachcomber now for a little over 6 years, and I was hired to begin an LGBT program, which I have done so. And what we have seen is that our community, I myself am gay and am in recovery for 31 years, and we see that our community is desperately in need of having a little bit of extra special attention and tender loving care. So each Friday we have a specialized group that meets for 3 hours, and we generally take one of the most pertinent topics of relationships, resentments, living in the gay community as a sober person, and things such as that. And the clients get to participate and join their journey of recovery with us. One of the things that we have seen is that the LGBT community is 30 times greater with having an addiction than the 9% of regular straight people. So we have a large group, and here in the Wilton Manor areas, we have a very large group that are addicted to crystal meth. So we try to deal with all the different addictions, and as well as the specialized group, they attend two other groups weekly, plus an individual session, generally with myself or with one of the other therapists.
Okay, and do people have a chance to, do most people go to one group, multiple groups, or it is in a mixture of group and individual sessions? What do you have found works best for individuals that come to you?
Well, what we do have is we have 2 programs here. The PHP is 6 days a week, and they meet for 6 hours daily. And so they'll have groups continually all week with a 1-hour individual during that week. The intensive outpatient program meets 3 times a week, and they'll meet with the LGBT program on Fridays and have an individual session as well. So we generally like to start them with the PHP and then drop them down to the IOP level.
Okay, and explain what PHP and IOP, for someone who might know, what does that mean?
Well, the PHP means partial hospitalization, which, like I mentioned, is the intensive 6 hours a day for 6 days a week. And the intensive IOP is three days a week. They can choose their 3 days, and those groups are for 3 hours a day, and plus an individual session.
And IOP is intensive outpatient, is that correct?
Right, correct.
Okay.
And both of them are either living in sober living homes or in outpatient, or at their own homes.
Okay. And then you offer inpatient services too, is that correct?
That is correct.
Okay.
And then Eric will be speaking a little bit more about that program later on in the broadcast.
Okay. All right. So you offer both people for non-LGBT, and then you also have a special LGBT program that reaches our community, that's tailored for our community, and offers an extra level of interconnectivity, it sounds like.
That's correct. An interesting article I was reading not too long ago stated that there's 824 programs that say that they serve the LGBT community. And out of those 824, only 63 of them actually have an LGBT track or program. And we happen to be one of them.
Okay. Okay.
And one of the other things that we do that is very unique is that once the client has completed the program successfully, they are welcome back every single Friday for the rest of their lives free of charge.
Mm-hmm.
Because Jim Bryan, who is our owner, believes very strongly that our community needs that extra special encouragement.
Mm-hmm. Is the stories that people are able to tell each other that help build that therapy and the interconnectivity that builds between those group sessions?
Absolutely. That support of one another, and where they can feel that they finally understand each other and they can identify with each other, and that they don't feel like they're outcasts anymore.
Yeah, yeah. And Genna, you are the clinical director, and among other things, you also work with the trauma program.
Yes. So I've been with the Beachcomber for 7 years now, actually. I started as an intern, and I was a primary therapist, and I became clinical director 3 years ago. So I do still run groups. I take on clients and then manage the therapeutic staff. And a few years back, I went and was trained in rapid resolution therapy, which is a form of trauma therapy that we do here at the Beachcomber. Michael can also share with you a little about it, as he's trained as well, and he's actually done several of the more extensive trainings. So that was kind of our first exposure to what it's like to treat people who have trauma. And as I'm sure you can imagine, this community is also a community that comes with some heavy trauma. And so we want to make sure that we are able to reach everyone and identify issues aside from just substance use, because substance use is really just more of a symptom of a much bigger problem. So we have here at the Beachcomber a trauma group, and that meets once weekly, where clients can come into this specialized group where they feel really safe to process through some of the traumatic experiences that they have been through. And they will do that weekly for the duration of their time here. But in addition to that, once they become really stable in their recovery, they have the opportunity to participate in more individualized trauma therapy. And so they would meet with a therapist like myself or Michael to do rapid resolution, or some of us, including myself, are also trained in what's called EMDR, which is a little bit more intense. And that's something we would do with our clients who are really, really stable in their recovery.
Okay, and just for those of us who know, what does EMDR stand for?
Eye movement desensitization and reprocessing.
Okay.
And so basically that's like a really fancy way of saying that we're going to stimulate both sides of your brain to help reprocess traumatic memories.
Oh, okay, very interesting. And when you say trauma, do you mean what if someone's coming for trauma? What exactly does that mean for someone? Is it abusive relationship? Is it what kind of trauma is that? What are some prevalent things that they might want to see for trauma?
So trauma really can be anything. I like to call trauma anything that's an emotionally disturbing experience. For someone, that might be surviving a natural disaster, going to war, being in an abusive relationship, being bullied on the playground as a child. Trauma is really anything that is still causing you an emotional disturbance today and is preventing you or blocking you from being able to move forward and to maintain healthy relationships, sobriety, really maintain a level of optimal functioning.
And what are the factors that people would look for if they've had trauma that they might want to come see you? I know it's like a dysfunction in relationships, dysfunction in family, anxiety, trouble with work. What are some indicating factors that they would want to come see you?
So what we do in the beginning of everyone's process here is we actually do a screen for trauma, just to see if they've had any grief, loss, some of these experiences that I've just mentioned, abuse in their life, whether that be physical, emotional, verbal. We do a screening, and if they meet certain criteria of the screening, we will then move on to do a more specific assessment where we'll start to begin to assess some of their symptoms. Are they having nightmares? Do they have anxiety? Do they have difficulty trusting others? Are they having physiological symptoms of trauma? Do they experience flashbacks? amongst probably 20 something or more questions. And if they do meet any kind of significant criteria for trauma, we will then recommend them to our trauma group, and that will become a part of their treatment plan, and we will begin to address it from the time that they start here.
Mm-hmm. I think, and you can correct me if I'm wrong, there are a lot of people that have trauma, have the kinds of symptoms you're talking about, and don't realize they're a victim of trauma. They have post-traumatic stress disorder, they have insomnia, they have flashbacks. They don't realize they're suffering it, and they don't realize it's impeding their educational relationship or occupational functioning, and they don't realize they need help. And educating people that there are resources like that, and they don't necessarily realize that it is stacked up and it's been so long and part of their lives that they need help, and there is help for them for resources like this. Do you find that's possible?
Absolutely. I think trauma is a really scary word, and I think a lot of people are like, not me. Sometimes the same way that they don't necessarily want to admit they have a problem with substances, they may not want to admit that they've had some experiences in their life that are causing them not to be able to be at their best. And so, we try to do our best to be really sensitive around that topic, which is why we have these specific trauma groups, so that someone doesn't have to address those issues in a group where maybe they don't necessarily feel other people can relate. But just by providing education, a lot of times what I find happens is when we start talking about grounding techniques or just different types of what we call trauma reactions, that's when people start to identify, okay, maybe I've had something go on in my life that really needs to be talked about.
Do you have a lot of people come to you and start to talk and then realize they've been really held back because of some of the traumatic things in their life, and realize they have insomnia, they have depression, they have anxiety, and maybe didn't even know really that was what they had, and realized that they struggled with it for a long time? Do you see that a lot in people?
Absolutely. I think that many people here are self-medicating their trauma with substances. And I would venture to say that probably close to 90% of our clients, if not all, have experienced some form of trauma throughout their life.
And that the psychotherapy is a door for them to, and a venue for them to be helped with that. Yeah. And Eric, you are assistant director, and can give us some of the history of the Beachcomber and how the progress that you all have made and what you all are doing.
Absolutely. So my grandfather founded the Beachcomber in 1976, actually. Okay. My dad and his two brothers own the Beachcomber now, so there's actually a brother at each location. My dad and I run the Fort Lauderdale location, so you can walk into any of our locations, have coffee with the owner that day. I think that's something that really kind of sets us apart as far as a treatment program. It feels like family, even with our staff and our clients. I mean, it's really a small, intimate environment. We initially started out at our Delray location. That's our residential program. It's 16 beds. It's very small. It's on the beach in Delray. And then we started our intensive outpatient program in Boynton Beach in 2012. And then we started the Fort Lauderdale location in 2013. So we offer residential, PHP, and IOP, like Michael was saying. My grandfather was he was the clinical director at a very well-renowned program in Pennsylvania called Chit Chat Farms that later became Caron Foundation. And he ended up he developed a love for helping people, and he was an alcoholic himself. And he ended up coming down to South Florida and wanted to continue helping people with their addiction and their alcoholisms. And as far as family goes, we have many different family members that work in the business. My dad and I run the Fort Lauderdale location, like I was saying. My uncle Frank runs the Boynton location, and my uncle Joe and my cousin Ian run the Delray location.
So you all are a very family-based business that's very invested in the community. Let me get back to there we go. So yeah, you are very vested in the business and multiple levels of the business. We've got family businesses in our family too, so But that's amazing. Do you all feel like what percentage of your clients, if you can answer that, are substance abuse or substance addictions?
So, like our program is a primary substance abuse facility, so you do
Okay.
have to have some sort of substance abuse issues going on.
Okay.
Of course, there's co-occurring things that we treat as well, but
Okay.
the primary issue has to be substance abuse.
Is substance abuse. Okay. Okay. And how has the COVID experience affected the people that come to you? There's been a lot of, I think, a lot of depression, anxiety. I'm very curious as to the domestic violence cases that have been increased. The child abuse, I know, has to be on the rise with kids that are home all day. Have you seen any trends and changes in those kinds of areas since people are cooped up at home with each other all day long? Now, I'll toss this out to anyone.
Absolutely. I mean, I think people in general struggle with being at home anyway, especially folks who are struggling with substance abuse issues. I think it increases it more than anything. And it's been a learning curve. And it's been a real challenge to treat people during these times. And it's added a couple layers to our process of, we're having people screened and tested for COVID, and it's added a whole nother layer to it.
Has it presented additional challenges for people who are now out of work and now are home all day? They're not able to go out to have social interactions. The stresses of normal life without a support network. Have you seen that's increased substance abuse? Have you seen that as a trend in your patients? And again, I don't want to ask anything that's personal, but if you can, in general terms, it seems like that would be a huge factor.
Yeah, Oh, go ahead, Genna.
Sorry, I was just going to say that it's definitely added some complicating factors. I mean, just being very isolated is not good for an alcoholic or addict. Just eliminating the whole human connection piece, even from our therapy process, we've had to motion a lot of our groups to telehealth, and that really does pull away from some of the human connection. Most of our clients outside of here are attending support groups like AA and NA and different fellowships, and those meetings have all been motioned online as well. There's a lot more room for people to hide, and if they're having trouble staying sober, we may not be able to recognize that as quickly as we would if we were seeing them in person. I would say that also, just given like everyone being at home, it's difficult for our clients to find childcare in order to attend our groups now. Sometimes we're finding that there are people walking around in the background of some of the telehealth groups. So it's definitely caused a whole host of other issues that we've had to tackle and like little fires to put out along the way.
They estimated that it's about a 75% increase of relapsing and domestic violence and suicides that have been taking place since this epidemic began.
Our emotional trampoline, we were taught in our counseling courses that your emotional trampoline is held by a lot of people when you need that support. And this has caused a lot of people to not have those people holding on to that trampoline because we cannot go see them. I was not able to go see my family for 6 months. My parents could not come down here because we were so just frankly afraid of it. And it has cut off so much of that emotional support, which is necessary for people. And then I think as a result, they are moving more to drug and alcohol to try to fill those voids. And so I think, people really need your support so much more so for these kinds of addictions. And we have people walking in the background because we're here at home. My roommate is here because we're broadcasting at home. It's part of the at home edition, absolutely. So, but yes. What advice do you have to people who are struggling with these kinds of addictions? And obviously they need to come see you, but what kinds of advice might you have?
I would say that the support is there. You just have to remain connected, and we're happy to be here to help. We're here. We're still motioning. We're still, operating. The most important thing is just remain connected so that, when the time comes that we're allowed to reintegrate, we have people to talk to.
I would probably want to say to be gentle to themselves and not to beat themselves up, especially if they happen to relapse. I personally like to not look at it as a person who chronically relapses, but rather as a person who chronically recovers because they keep coming back.
Mm, mm,
And I would say to not let this difficult time deter you from getting help, because there are lots of resources out there, not just us, but there's lots of community resources that you can access, and to not let this discourage you during this
mhm,
tough time.
mhm. And what is I'll throw you one. What's one simple coping mechanism that people could do when they're feeling depressed or looking for drug and alcohol? What's a simple coping mechanism or a simple thing they can do? Mine. I'll tell you. Here's mine. Is I find the entertainment people I used to go out and see. They're doing Facebook live videos, and I put them on the Chromecast on TV, and I watch them, and it helps me to feel like I'm watching their shows, and it helps me to feel like I'm out with people. The other thing that I have done is that rather than chatting with everyone, I start video calling them on Facebook and on my iPhone and forcing myself to make that video connection. So if you have one little tip like that you've learned, if you want to share that, I'll put you on the spot. Sorry, I didn't answer that question ahead of time, but
I like to tell the clients to try to get to be involved in some kind of a creative activity that they can do to, stimulate themselves, even as simple as working on crossword puzzles and things of that nature, but just to keep themselves occupied and try to keep the downtime as little as possible.
Good.
I like to do something that it's kind of like something that helps ground me a little bit, that involves all of my senses. And so I will make sure that I kind of pay attention to like what I'm smelling, what I'm tasting that maybe still in my mouth, or if I put a candy in my mouth or something, I'll kind of notice my feet or hands and where they are, and just what I visualize right in front of me. And so once I engage all my tactile senses, I'm able to kind of like take a step back and reset before I make any kind of
Mm.
decision based on the situation that's going on right
I really like that one. I like that one a lot. Thank you. Eric,
I
what's
think like
what's one little thing you do?
I think like you're saying, reaching out to people and forcing yourself to communicate with people is really important. Something that I do personally is I like to go to the beach a lot. I surf. If you can't tell, I surf a lot, and I there's not great surf here in South Florida, but my fiance and I like to go down to the beach. We live way out west, and it's kind of a mission to get there, but it's so peaceful to just go sit on the beach, listen to the water, and be with nature.
Mm. That's good. Well, thank you all for joining us. I've seen the wave. I seem to have noticed more so personally in the last month, people reaching out who are kind of at their breaking point. They're kind of a little, I don't know if the word is fed up, but they've really started to wonder and struggle with some depression issues, a lot of different emotional issues. And I see now, I think we're in this for the longer haul. And so I keep telling people, do not suffer alone. Reach out. And as a wise person once told me, don't waste your suffering. And there are valuable resources for substance abuse, like the Beachcomber. I've sat with Michael and I've talked with you all, and you all are offering some great services. And there are resources out there. Don't struggle alone. Do give them a call, whether you use their services or not. Give them a call, and they can help you and guide you and plan for what is best, because this is a difficult time, but there are resources out there. Is there anything? Oh, sorry, I hit the wrong button. How do I make that stop? There we go. I hit the key on the keyboard. Is there anything I didn't ask that you'd like to cover? No?
No?
And my last question then is always, how do we find you online and connect with you to get to your resources?
So you can visit us on our website at beachcomberfamilycenter.com,
Okay.
and our direct line is 615-4003.
Okay.
It's 954-615-4003.
Okay. And it is beachcomberfamilycenter.com. They have multiple locations, so you can find out all their different locations and all their different services on there to help you out. So don't suffer alone, whatever you're going through, and times will get better. We're going to put up their website here so you can see that. So partial hospitalization program located in Fort Lauderdale. So visit their website. All right. Thank you all. It's been really great talking to you. I appreciate your services, and reach out to them if they have questions, and they will be able to help. Thank you all, and have a great afternoon.
Thank you so much.
Thank you.
Thank you.